ctDNA really has been a truly amazing technology for us in GI cancers. I think it started out really in the MRD or minimal residual disease space, so really helping us for people who have undergone what appears to be, curative intent surgery to help identify who really needs adjuvant chemotherapy and who are patients that are going to recur despite us giving the adjuvant chemotherapy. So I think we have some really good data now in stage 2 colorectal cancer, especially from the dynamic trial, showing that, we can safely omit chemotherapy for double the number of patients that we used to in sort of standard management. And they experience the same outcome. So despite giving less chemotherapy, people are still doing very well. So, that's a huge win in a space where, we've been treating a lot of people that we knew were not benefiting, and so to be able to avoid that, to avoid the acute side effects of that, but also, the long-term, neuropathy especially is such a debilitating toxicity with oxaliplatin. So to be able to avoid that for many patients is a big win. We also have a lot more data, in later stages showing that by giving chemotherapy to people that are ctDNA positive after curative intent surgery, that we can actually improve outcomes. By clearing ctDNA, we can actually improve or delay recurrences or even prevent many recurrences. So there's definitely a lot more to be done in that area for sure to confirm these findings, but certainly, very strong early and positive signal. And then lastly, I would add for the screening space also, these assays are being developed really for GI cancers and others to help detect, the onset of cancer, which especially in this era of early onset cancer, where we're seeing so many more young people with colorectal cancer or gastric cancer and many others, these are populations that are very difficult to screen with imaging or colonoscopies. But if it's a simple blood test, that's an easy sell, for a young patient who probably is getting labs checked by their primary care doctor every so often anyway. So, there's definitely a lot of potential power there for ctDNA to be a good screening test in a population that we need to start screening in, but really can't do in a practical way right now with the existing modalities.